We've been using eHNA, so a paper version of this, for 2 years. And the idea is that patients, it's capturing what they're really bothered about. So when you start chemotherapy, there's lots of information that you have to be told. You can get life-threatening side effects and symptoms, and that's really important that patients understand that. But you get lost on what the patients are really concerned about. So what the eHNA does is put the focus back to the patient, so that it becomes patient-centred care rather than speciality-driven care. And for some people, having the chemotherapy isn't the most important thing that's going on in their life at that time. There was a lady who was having probably her last lot of chemotherapy, who still had to try and sort out who was going to look after her children if she died. Chemotherapy wasn't a big issue for her. It was about her children. And a lady whose husband had really severe dementia, who didn't have a backup plan if she got admitted to hospital with the side effects of her treatment. So would we have picked those things up without the eHNAs? Not sure. But we did, and therefore it becomes that's what's important to the patient, and the chemotherapy is almost secondary to those people. So doing it electronically is really innovative. We're the only chemotherapy unit in the country doing it, and it's all done on an iPad. So the patients complete, there's a series of questions. It's a Macmillan funded project, so people can look on the Macmillan website and get more information. But the patients tick, so a series of questions covering just about every aspect of their life that you can imagine, and they score the answers, so from 1 to 10. And then when the nurse sees them, to talk about the chemotherapy, the side effects and things, then she can say what the patients are bothered about. So you give your bit, you tell them all the things they need to know that might just save their life at some point, but then you can say, so okay then, what are you bothered about? What do we need to talk about? And you can signpost the patients then to what they really need the first time. So that what can happen is that somebody talks to me, they talk to somebody else, and it all gets really bitty and bobby where they get their information from and how many times they're signposted to different people. And this way we know up front what they're bothered about, we get them to the right place for the right information first time.